Are. Can you hear me, ma'am?
Yes, yes, yes. But we are
Yes,
not able to see
ma'am.
you.
Yeah. यहाँ पे आवाज बहुत धीमी आ रही है.
Yes, yes, Roshita.
Yes,
Hi.
ma'am.
Yeah. Shall I start, ma'am?
Yeah, Sahiti, please start. Make it
Okay.
live. Yeah,
Okay.
Yes, yes. Now I can hear you.
yeah.
Good evening, esteemed faculty members and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar. And today we are back with our series Med Mocha Meetup Season 1, Session 19. And today it's a mixed bag webinar consisting of two eminent speakers. So let me introduce the organizer of this webinar, Dr. Ritu Santwani, ma'am. Ma'am has done MBBS, MD, FICOG, FIAOG, AMRCOG, ART Singapore. Ma'am is consultant obstetrician and gynecologist, infertility specialist, sexologist and cosmetologist, founder and CEO of 360 Degrees Healthcare Studio. Ma'am is also a part of NUHS Singapore, co-founder of MAAM and board member of SWWC. Ma'am is the top 50 influential doctors on social media. So I welcome you, ma'am, and I hand over the session to you.
Yeah. Thank you, Sahiti. And first of all, warm welcome to all of my dear friends who have joined all across the geography. A warm welcome of today's our stalwart guest, Dr. Shirish Malde, and my dear friend, Dr. Roshita. A very warm welcome to you. Friends, as we all know, knowledge is power. Knowledge always increases by sharing. With this motto, I started this series at the time of the lockdown. And by the grace of the God and my Mata Rani blessings, now still the 4 years have passed, still the program is rocking. And the only motto of starting this program that whatever the difficulties we are getting in our day-to-day practice, so we can discuss with each other and we can help each other. At the time when I passed out 24 years back, that time the internet was not so good. We can't connect. So at the time of the lockdown, I started this series. So touchwood, still it is going very well. So a very, very warm welcome to my dear friends and big thanks to Shield Pharma also and for providing the platform. Friends, in this webinar, not only from the India, a lot of the doctors apart from India across the geography also join. So may I request Sahiti, please introduce our first speaker, Dr. Shirish sir.
Yes, ma'am. So it's my privilege to introduce Dr. Shirish Malde, sir. Sir has done MD and fellow in CSCPI, diplomate from the American Board of Sexology. Sir has been practicing sexuality educator and counselor and therapist in Mumbai since last 25 years. Sir is a visiting faculty at Goa and Belgaum. Sir is the founder president of Association of Sexuality and Reproductive Health Practitioners and ex-joint secretary of CSCPI and ex-national vice president of Family Planning Association of India. Sir is the pioneer of telephonic helpline services for sexuality in India. Sir is the trainer and educator in issues related to sexuality, marriage counseling, family planning, and HIV/AIDS. I welcome you,
So
sir.
Please stop sharing, Sahiti. Yeah. A very warm welcome to you, Dr. Shirish Malde, sir. First of all, thank you for accepting the invitation. So today, Dr. Shirish is going to discuss with us a very important topic, the sex toys in sexual medicine. I am being a gynecologist. Lot of patients these days are coming, having lot of queries related to sex toys. They are seeing some of the half knowledge they are getting by the social media. And post use of the sex toys, I have seen a lot of girls from the vaginitis also. They are not aware how to clean the sex toys properly and how to use it, whether they can reuse or how to use that. So to know all about that, we will invite today our dear friend, Dr. Shirish Malde, sir. So a very warm welcome to you. The dais is all yours.
Yeah, thank you, ma'am, for your kind invitation and very nice initiative since lockdown. It has become a blessing in disguise. Such webinars can be arranged across the globe and a nice academic initiative, I would say. Today's topic, can everyone see the screen?
Yes, yes, yes. Still, you have not started sharing, na? We can
No,
able to see you.
yes, yes. No, no, I have started sharing it.
No. No,
Okay.
we are not.
Okay. Just a moment.
Some friends have joined. Dr. Abdullah from Kabul has joined. Dr. Tariq, you have joined from Bangladesh, if I am not wrong. Hmm. Yes, yes, we are able to see now.
Okay, yeah, fine.
Welcome, Dr. Hashmi. Welcome. Good to see you.
Rishi, yeah, now it's a
Yes.
full screen.
Yep. Perfect.
So very aptly said, sexual medicine is a topic where lots of half-baked knowledge is available on internet, and sex toy is one of them. So today we'll see what are the various types and mainly its utility in the sexual medicine. So sex toy is basically an object or device that is primarily used to facilitate the sexual pleasure. And the most popular sex toys are designed to resemble the human genitals, and they are also known as adult toy or marital aid. Now, coming to the history, these devices, the first of its kind, where vulvular stimulation were popular for the women who were having various illnesses, including hysteria. It was supposed to say that hysteria results from the unsatisfied sexual urge. And to complete this, these devices were used. And first device was manipulator, developed by an American physician, George Taylor, and which was working on steam, the technology which was prevalent at that time. Joseph Grenville later modified and made it as an electromechanical device in 1880. But in 1902, Hamilton Beach Company patented the first vibrator and put for retail sale. And it was much before vacuum cleaners and electric iron. Now, in the history again, after 1922, they became quite popular, but later on, they were widely shown in porn literature and hence they were shunned by the polite society. However, later they re-emerged very strongly after 1960, the well-known sex revolution in America and Europe. And constant improvement continued with the technology, and features like multi-speed, one-piece, cordless, like battery-operated, made them simple, easy to use, handy, and cheaper too. And in 90s, they became widely accepted and featured in various media and popular programs like Sex and the City, etc. And then they became the object for the common people also. Looking back into the history in Mohenjo-daro and Harappa, the phallus-like objects were found, but officially the documentation is not found. But our ancient treatise, Kama Sutra, one finds the mention about it, where the Rishi Vatsayana recommends the use of artificial phallus for this couple, where the female partner fails to get the desired gratification from the male partner. And this artificial penis was known as apadravya. They are made up of gold, silver, copper, iron. Those were the metallic, ivory, wood, and for the poor men, the buffalo's horns were also used. Whereas for men, Vatsayana had recommended pratima, which means the statues. The modern world now has sex dolls. There were few other objects like Valaya, which was a basic model. Valaya means a circular ring, where the outer surface was rough. They were like
the vaginal pessaries to be inserted in the vagina to derive sexual gratification. Sangata were combination of two valayas. Then Chudak was a combination of three sangat, and Kantuka, which was a hollow tube with a strap which can be tied around the waist. So it was just like a harness with artificial penis. What are the various categories of the sex toys? The sex toys are for men, they are for women, they are for couples. There are various types of condoms, the sex furnitures, erotic clothings, the fetish objects, the lubes and lotions, and finally porn literature. So they are all mainly designed to facilitate or improve upon the sexual pleasure the man ultimately looks for. So various types of vibrators, you can see more or less resembling the phallus are available. G-spot vibrators are there, which are primarily there to arouse the G-spot, but simultaneously you can see here, they are primed to stimulate the clitoris also. Then vibrator wand, which provides a very strong stimulations inside the vaginal cavity. This type of rabbits are quite popular, and this is a phallus which may be filled with a gel-like substance. These are the bead, so it gives little uneven surface and they move or rotate. And this portion, which is known as rabbit, is mainly used to stimulate the clitoris. So simultaneously, the G-spot, inner lining of the vagina, and clitoris, all three areas are stimulated simultaneously. Then there are the small eggs which are inserted inside the vagina, and with this battery operated device, the eggs are vibrating inside the vagina. The depth can be varied. These are the most common currently used vibrators, the gel filled, which has a battery here. They are simple AA battery operated, and these are the strapped. So this can be put on the pelvis by man, and this penis can be hollow. So man can put his non-erect penis inside this artificial penis and can give thrusting during the penovaginal intercourse. There are some more sophisticated undercover vibrators. These are also battery operated and can be used underwater also, just like a scuba diver who moves towards the vaginal cavity and finally gives pleasure to the clitoris. There are pocket, very small device, which are known as rockets. Then butterfly-like device, which is placed along the vulva and strong stimulations are produced. Then there are double-ended devices like this, which can be used by lesbian couples where both the ends are inserted by both the partners simultaneously, and then the pelvic thrusting is performed. Then there is a penis sleeve where a man can put his non-erect penis either partially amputated because of carcinoma or other diseases, or some people who are having a very protruding belly where the penis becomes relatively smaller because of they get buried inside the pelvic fat. So they wanted to increase the penile length by this penis sleeve. Then similarly, penis extensions are there, which can be, are available with the knickers. Then cock rings. There are two types of cock rings. One is based at the base of the penis and used to sustain the erection, where people either because of the venous leakage or because of even arterial insufficiency, men tend to lose erections. So these cock rings holds up the erection for some time until the man finishes the act. And there are some rings which are placed around the corona sulcus of the glans, and they are mainly used and mainly primed to give additional stimulation along the vaginal wall. Then there are penis vibrator rings put along the condoms, or they can be put along without condom also, and it has a small buttons here inside this central place. And when the button is switched on, they vibrate gradually and in a more profound way. This area is designed to touch the clitoris and give stimulations by vibration. Then there are cock harnesses, just like penile sheaths, which has a harness to be worn around the pelvis to give the thrusting during the peno-vaginal intercourse. Now, for men, there are artificial vaginas, just like the pelvic models which we have in our anatomy labs and in many sex gazettes. Such artificial pelvis and vagina are available, and they are nowadays made up of such a nice rubber which very much resembles like the natural feeling. There are certain vibrating artificial vaginas also, and there are more sophisticated known as the vaginal flush, which are available, and they resemble very much like the artificial vulva. And in many ART centers, these devices are used to produce semen sample in a man who under pressure cannot give the semen sample for ART purpose. Then there are anal toys like anal beads. By the way, anus is also one of the erotic zone or erotic sexual organ for many men and women. There are anal plugs which are inserted, and they are given to and fro movements. There are glass or steel or wooden anal toys like this, or vibrating anal toys are also there. Depending on the individual choice, they can prefer and use it. The anal beads are introduced in the anus, and then they are gradually pulled out, same like the vaginal balls, also the same way. There are nipple clamps also. Primarily, these objects are non-vibrating. Just by their mechanical presence and mechanical to and fro movement, they give sexual pleasure in these areas. I have come across few people who have used the thread balls they introduce in the anus or vagina, and once they start pulling the thread, it gives the sexual pleasure. And very weird cases I have seen where people have inserted the earthworms, the small cockroaches also inside the vagina, which when crawl inside the cavity, they give a much sexual pleasuring stimulations to these people. Now, people are not happy with only genital parts, so they develop the life-size or full-size dolls. These are the primitive ones where you see they are inflatable and they have oral cavity to accept the erect penis. They have vagina and they have anus also. So men can have 3 openings for insertion. They have the breast, what men fantasy about, and they can actually have pelvic thrusting movement with this. They are usually having a length between 4 to 6 feet once they fully inflated. Another type of dolls. And for women also, the men dolls or the male dolls are available. Remember, these are about 8 to 10 years old editions, and now more sophisticated and advanced dolls are available, which are very much resembling the natural ones. So this is one of them. The another one, and these are also 2 to 3 year old, jokingly called as iWife from the Apple series. They are beautiful. They are more curvy. They are comfort giving to man. The most important factor that one looks for is they are obedient. And another important factor that man looks for in a woman, that they have a mute button. So some of them, they do have a lewd talking, which arouses many men. So if those who do not want the lewd talk, they can mute it. And nowadays, you will come across still further advanced sex toys, the full-length sex robots. Many of them are AI equipped. They do a lot of house chores also, and they are programmed to serve for the domestic use as well as the erotic use also. So many movies which look fiction 5 years, 10 years down the line, now are turning into the reality. So why only boys should have fun? For females also, the male sex robots are there, which are also AI generated, AI featured, are loaded with them. And they can also have a lot of program for the common sexual activity what men or women are looking for. Then next category are sex furnitures. Simple furniture like this can have a lot of utility like this. It can serve as a perfect furniture where a lot many sex positions can be attempted by man. Another common sex furniture which is very popular and having a very high online sale is a device something like this. It can be inflated, and there are some devices which are made up of plastic or even wood also with the same shape. And as you can see, this can be used for many positions. It facilitates the couple to get engaged into various sexual positions into this. Then there are erotic clothing, much popular lingeries, set of lingeries, which can be transparent. To give, it is said that semi-nudity is more exciting to many men than complete nudity. So erotic clothing are the perfect examples for them. There are many fetish like handcuffs and eye strips. Then there are some small hunters, anal devices. Uh, these are mainly for people who have a mild tendency or mild liking for sadomasochism. They're inflicting pain to the partner or receiving pain during sexual intercourse gives them the turn on. So such sadomasochism, people who have a mild degree often performs this, and in many Ekta Kapoor's two OTT platforms, Alt Balaji and there is one more. So there you see many Hindi serials are made with these fetish objects. And lastly, some erotic lubes are also available. So they are with the many flavored, mainly fruit flavors, and they are innocent in a way that they can be ingested also. So these lubes can be used for various purposes to give erotic massage to non-genital and genital organs, and of course to facilitate the penetration into anus and other uncommon areas. So why people use these sex toys? The foremost is to turn on. Many people get turned on by using such things, and the main aim the people are looking for using the sex toys or the sexual aid is to enhance sexual pleasure. And this enhancing sexual pleasure finally leads to gratification, and the sexual gratification has all its physical and mental health benefits. So people who suffer from dysorgasmia, who are not able to achieve climax or orgasm during sexual act with the partner, are very easily they can achieve the sexual gratification with such toys. Many people can live out their fantasies with such objects. It helps to break marital monotony in many men after a few years of sexual activity. They are looking for some activity which breaks their monotony and can turn on. And it's an alternate way for sexual gratification for both men and women in absence of partner. And these people can be single, they can be divorcee or having separation, they can be physically or mentally challenged, where the marriage is not possible or having partner is not possible for them. But yes, many people do still have sexual urges which needs to be satisfied. In people where the partner is there, they have a so-called happy marriage, but partner is refusing sex persistently. So they do not want to break marriage, they do not want to have divorce for various reasons, but they are not satisfied or not happy at all because partner is persistently refusing sex. So it opens another avenue or another window for them. And for many people where partner is staying away, either for job purpose or for many other reasons. So for such individuals, this sex toys turns out to be a boon or a blessing in disguise. Now coming to the sexual medicine, where as a practitioner in sexual medicine, how they can be find it useful. So in cases partly amputated penis or people have a small penis due to extreme obesity, that protruding belly is burying more than 50% of their penis. And in cases of absent ejaculation, very commonly seen in many ART clinics, where a man is asked to give semen sample either for primary semen analysis and under pressure is not able to ejaculate and is not able to give the sample. Or in cases where artificial reproductive technique like IUI or IVF is planned for them and the man like under facing sword is not able to give samples. So for such individuals, uh, uh, vibrator-like devices are a boon to give them sexual stimulation where they can ejaculate and give the sample. For position learning in cases of non-consummation of marriage and in for many couples for position variation, one can use such devices. Surrogate partner, not common in India and not legal in India, but they can be a safe, readily available and no tantrums from them. And as an anal dilator for painful anal conditions. This is the commonly used massager or vibrator which we use and has saved hundreds of cases where unexpected failure have made the ART technique redundant. Many couples who faced unexpected failure to give sample at 11th hour also, if they attempt this or even they do this, their IUI cycle or IVF cycle can be saved because in 90% of the cases, such massagers give the semen sample required for ART. For women, many objects can be an adjuvant to sex therapy or sensate focus therapy, where women is primed or made to learn how to reach orgasm. So for cases of anorgasmia or dysorgasmia due to various reasons, and surrogate can be a surrogate partner as a vaginal dilator for vaginismus. And believe me, hundreds of cases I have solved with the help of vaginal dilator, either the graded dilator or finally this vibrator where it gives some sorts of sexual stimulation where it increases the threshold to bear pain during vaginal penetration. And it can be used as anal dilator for painful anal condition in women as well. So what are the harmful effects physically? Yes, the plastic or the chemical used to make such device like phthalate, vinyl or silicone may cause some health hazards. The unhygienic use can spread infections. The organ laxity can happen if the vaginal dilators are used, which have a larger dimension. So later on, when a man attempts penile insertion, then he may find the vagina much lax, or it changes the normal vaginal flora. Psychologically, yes, it can change the sexual behavior pattern, and in many cases, the partners prefer the device more than partners, and interpersonal conflicts may arise because of such issues. Legal status in India, we have the Victorian era law. Of course, now IPC is replaced by the Bharatiya Nyaya Sanhita, but in no major shift is seen even in BNS for the outlook towards sex toys. And Indian Penal Code earlier, Section 292 used to deal with sale with these sexual toys and obscene books. So the sale or hiring such devices or distribution or publicly exhibition in any manner put into circulation or for purposes of sale, hire, distribution, public exhibition or circulation makes or production or even simple possession of any obscene book, pamphlet, paper, drawing, painting, or representation or figure of any such object, whatever draws the penal action according to IPC. Or importing or exporting or conveying any such objects for any other purposes aforesaid can put you in other side of law. So, what are the uses or exception or takes part or receives profit from such businesses or advertise or makes known by any means by the practitioner or offers or attempts to do any act which is an offense under this section shall be punished. An exception is given very surprisingly for such material for religious purposes. I think they may be aiming towards the Shivlinga, and existing in museums or archaeological sites are the exceptions to possess this. Penalty on first conviction is imprisonment for 2 years and with fine up to 2,000 rupees. And for subsequent your crime, the second conviction has an imprisonment for up to 5 years and fine up to 5,000 rupees. And it is a cognizable, bailable offense tried by any magistrate, and it is non-compoundable. So physician's dilemma, can I suggest, prescribe, or by any means promote it for the indicated problems in couple? Can I supply it for the needy client, or can I keep it in my client as a mean of sex therapy? Well, answer is a little dicey. You make them. We need to have some kind of advocacy so that we can make them acceptable objects. The state should recognize the importance of sexual health and right of every individual. So the right of sexual pleasure can cover use of such sex toys, and you can name them as sex aid rather than sex toy. And emerging trend in this field with this more and more advent with the AI and technology, the emergent technology is ever expanding with the human sexuality. The remote sex can now be a reality. The partner can be in US and the other partner is here, but there are some apps which will make feel the kissing also possible, and even the penetrative sex sensations can be possible with 3D interactive sex games. The virtual reality and entertainment is almost knocking the door. Sex robots are now available. The human augmentation so that the new AI tools can read the mind of an individual. So whatever there, some kind of a wild desire or some weird fantasies can be read by such devices, and they can facilitate man to implement it. And more sex technology can bring more revolution in this field. So thank you everyone for listening. We can take up any questions, Ritu ma'am, either
Yeah.
now or
Yeah.
at the end of the session after the Dr. Ruchita's session.
Yeah.
Thank you.
Thank you so much, Dr. Shirish. It's a wonderful presentation. Words are less to praise you. Really a wonderful presentation. On this platform only, I will request you again. I will be happy to invite you once again on my show. So need a promise from your side that you will also give us time once again.
Certainly, ma'am. My pleasure. That will be my
Thank you.
pleasure.
Thank you so much. Because till now here I am not able to see the questions. YouTube questions will appear little late. So may I request Saiti, will you show the certificate of appreciation for Dr. Malde, sir? Anand Jawar, sir, good evening. Good to see you, sir.
Just a second now.
Yes.
Yeah. Dr. Jawar, you have to unmute yourself.
Yeah, it was very nice presentation, Dr. Suresh. Congratulations.
Thank you, sir.
Yeah, very nice.
Good to see you, sir. Thank you for
Yeah.
joining.
Yeah, Ritu, you are doing wonderful job.
Thank
Very
you, sir.
nice.
Thank you. Thank you so much,
Nice.
sir.
Thank you, Ritu ma'am,
Yeah.
for the
Yeah.
certificate
Yeah.
of
Okay.
appreciation.
This is a
Thank you.
certificate of
Sure.
appreciation for to Dr. Shirish Malde for contributing as a distinguished speaker for today's session.
Hmm.
Where really we are feel honored to have you with us. Thank you so much.
Thank you. Thank
So
you, ma'am.
now without wasting time, I'm handing over the session. First, Saiti, I will request you to please do the warm welcome, my dear friend, a very bubbly girl, Dr. Roshita. Yeah, please
Yes, ma'am.
introduce her.
Yeah, it's my pleasure to introduce Dr. Roshita Kare, ma'am. Ma'am is psychiatrist and sexologist from MNAS Clinic, Pune. Ma'am has done MBBS in MGM Medical College, Indore. Ma'am has done DPM, MIMER Medical College, Pune. Diploma in Child and Adolescent Psychology. Member of IMA, CSCPI, IAS MPMM, PPA, and IPS. Ma'am has worked as senior resident in MIMER Medical College, Pune for 5 years. Ma'am has teaching experience for MBBS and physiotherapy students, special interest in adolescent and women's psychiatry and sexology, part of many awareness programs under Pune Psychiatry Association, part of many mental awareness activities on FM radio, part of Samvad, a mental health awareness program. Ma'am is also a part of many webinars and conferences as a psychiatrist and sexologist. So I welcome you, ma'am, and I hand the session to you.
Thank you so much. Thank you so much.
A very warm welcome, dear Roshita. So
Thank you,
today,
ma'am.
Roshita is going to discuss with us related to the postpartum depression. Being in a gynecologist crowd, I invited today one sexologist and one my psychiatrist come sexologist friend, Dr. Roshita. As we all know, friends, we all are seeing the patients coming to us with the postpartum depression. Of course, we are treating us, but still sometimes there is a dilemma. Which drug will be safe? Of course, we are doing the counseling. Counseling plays a very important role. Now, which drugs we can prescribe, which are safe at the time of the lactation? And sometimes we are seeing in our Indian scenario, they are expecting for the male baby, if suddenly the female baby comes, then also the lady goes from the postpartum depression. Or sometimes if there is some IUD happened, then also it happens. So to know it related to this about in more detail, I'm handing over the dais to Roshita. Warm welcome, dear.
Yeah, thank you, ma'am. Good evening, everyone, and thank you for attending this webinar. And thank you so much, Ritu, ma'am, for giving me this opportunity to speak on this platform. So, I'm Dr. Roshita Khare, and I'm practicing in Pune as a psychiatrist and sexologist since many years. And today, we are going to explore about postpartum depression. And I hope by the end of the session, you will have a clear understanding about it. So before we dive into the topic, I would love to know how many of you have experienced this or came across cases related to postpartum depression, and you are free to share your experiences in chat box. So let me share my screen now. Yes.
I think everyone must have come across to the patient for the postpartum depression. Yes, we are able to see your
Yes,
screen.
yes, 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 ma'am. Yep. Full screen is visible.
Only make it full screen, please.
Yes, yes.
Yeah. You take your own time, no problem.
Yes, ma'am. Full screen है, नहीं हो रहा।
Sahiti, you can please you guide.
Yeah,
Yes, ma'am.
can, ma'am.
Yeah, we can see full screen.
Yes, yes, yes. Actually, we are going to discuss about postpartum depression. So, having a baby is a life-changing experience. I have experienced this thing, and being a parent is exciting, but at the same time, it's also very tiring and overwhelming also. And it's normal to have feelings of worry or doubt, and especially if you are a mom for the first time. But if these feelings are extreme sadness and loneliness, or severe mood swings or frequent crying spells, so yes, it is about postpartum depression. So coming to what is postpartum depression? So postpartum depression is a complex mix of physical, emotional, and behavioral changes that happen in some women after childbirth. And according to DSM-5, जिसको कि हम हमारी गीता बोलते हैं साइकेट्री में, so according to it now postpartum depression is now included in perinatal depression, and perinatal depression is a major depressive episode that begins during the pregnancy or within 4 weeks after the pregnancy or childbirth. And the diagnosis of postpartum depression not only depends upon the length of time between onset of symptoms, but on the severity of the symptoms also. So, what is the prevalence of postpartum depression? So, the prevalence of postpartum depression is relatively high, with studies estimating that around 10 to 28% of females experience postpartum depression after childbirth. And in US, the prevalence rate is around 10 to 15%. However, globally, it is estimated that about 10 to 20% of women experience postpartum depression. However, according to certain studies, the rate may be high, on a higher side. And the prevalence of postpartum depression varies across different regions and population, which depends upon the accessibility of healthcare practices, facilities, cultural practices over their support system, and the economic system. So the key regional statistics of postpartum depression prevalence is in higher income countries, it is around 10 to 15%, like US, and in low and middle income countries, it's around 18 to 25%. So coming to postpartum psychiatric disorders, I have divided it into three categories. One is the postpartum blues, other is postpartum depression, and last is the postpartum psychosis. So postpartum blues, ये मुझे भी हुआ था, so I can relate to it. So it's the incidence is around 70 to 80%, and it happens within the first week to 15 or 16 days of the delivery. And the chief symptoms are tearfulness and anxiety mostly. Postpartum depression, the incidence is around 10%, and it happens within first month of the delivery. And the symptoms are usually depression, feeling of guilt, anxiety, fear, insomnia, or obsessions usually related to the baby. And postpartum psychosis, it is a rare condition. If postpartum depression goes untreated, it can end up in postpartum psychosis. And the incidence is around 0.1% to 0.2%. And it also happens within the first month of the delivery. And the major symptoms are disorientation, confusion, hallucinations, means a female can hear voices which are not real, or delusion, any belief which is very strong, which can't be changed by anything. So delusions are there, and rapid mood swings are very common during postpartum psychosis. So coming to the symptoms of postpartum depression, so I have classified into a few points like persistent sadness or low mood, uh, uh, more than for a 2 week, loss of interest in day-to-day activities, especially the activities which are enjoyable for a female when she is with the baby. So they are not able to enjoy those activities, or any day-to-day activities which were enjoyable for the female. They are not able to enjoy those activities. Extreme fatigue or lack of energy despite of taking proper rest, irritability, anger that may be directly mostly towards the baby or the family members or the partner. Feelings of worthlessness or guilt, which again regarding the feeling that maybe I'm not a good mother and I'm not able to take care of my baby properly, difficulty in bonding with the baby, and usually feeling detached with the baby. Other symptoms which are common for postpartum depression include anxiety, excessive worrying, especially about the baby's health or parenting abilities. Am I a good mom or not? Sleep disturbances are very common, like the person is not able to sleep despite giving her time कि हाँ तुम सो जाओ, इसके बावजूद भी वो सो नहीं पाती, या sleeping too much and neglecting baby's care, difficulty in concentrating, making decisions or remembering things, changes in appetite, like either eating too much or too little, which is not sufficient, and thoughts of self-harm or harm to the baby even, which can be a sign of most severe form of postpartum depression. Uh, then coming to what are the causes of postpartum depression. So I have divided it into few categories like biological factors, psychological factors, social and environmental factors, lifestyle and stress related factors, or pregnancy or birth related factors. So coming to the biological factors, again biological factors are divided into few categories like genetic predisposition. If there is a family history of depression, anxiety, or other mood disorders, so that can increase the risk for postpartum depression in a female. Biological factors may hormonal factors are very common, as we know that during the pregnancy, the level of estrogen and progesterone hormones are way much higher just to maintain the pregnancy. But as soon as the baby is delivered, these hormones sharply go down. Within 2 or 3 days, there is a sharp decrease in these hormones, and again that can lead to the mood swings in a female. Then in some females, they develop thyroid dysfunction during the pregnancy, which can also mimic like symptoms of postpartum depression. And coming to the psychological factors, so if there is a previous history of mental disorder in a female like anxiety, depression, or mood disorder, that increases the risk for postpartum depression in the female. Then if the female is dealing with low self-esteem or low confidence since very long time, so it again increases the risk for postpartum depression in the female. And then negative birth experience. If the female have gone through negative experiences in the birth, like painful labor or painful C-section, or there are certain problems during the prenatal period also, there were infections or something like that. So that can also increase the stress level and again increase the risk of postpartum depression in a female. Now coming to the social and environmental factors, in that lack of support is very important factor in causing postpartum depression. Like if there is a poor support system from the family or from the partner, and the female have to deal with all the things alone, then it increases the stress level in the female, and that can result in postpartum depression. Then if there is marital relationship issues with the partner, so again that increases the risk, and the female has to take care of the things alone, so that also increases the risk for postpartum depression in the female. Then single parenthood, if a female is handling all the things single-handedly, there is no partner, so it increases the stress level, and that increases the susceptibility for postpartum depression. And last but not the least, having a child with special needs. If a baby is born with special needs or any anomaly, that increases the stress, and the female can end up with postpartum depression. Then coming to lifestyle and stress factors. So in lifestyle factors, if there is sleep deprivation, just we always know कि जब भी बच्चा पैदा होता है तो नींदें उड़ जाती हैं माँ बाप की. So so if there is changes in sleep patterns, so again your stress hormone goes up, and again it increases the risk for postpartum depression. Then if there is financial stress, a baby is born with lot of demands nowadays. लाइक पहले जमाने में इतना नहीं होता था, लाइक अवर पेरेंट्स यूज्ड टू सी, बट आजकल बेबी इज बॉर्न तो डॉक्टर बोलता है लैक्टोजन भी दे दो, डाइपर भी बच्चा उठा लो. तो इट अगेन इंक्रीजेस द बर्डन ऑफ financial burden on the female, and baki jo and other household chores the female has to manage, so that can increase the financial burden and again stress level, and again the female can end up with postpartum depression. Then unrealistic expectations from the relative or from the family members कि like अभी बच्चा हो गया है, अब इसका आपको अच्छे से ध्यान रखना है, आपको तुरंत इसके साथ बॉन्डिंग डेवलप हो जानी चाहिए. तो these expectations also end up with like am I a good parent or not if I am not able to bond with the baby. And the mothers जो माँ नई नई होती हैं तो घर के बड़े बुजुर्ग उनको बोलते हैं अक्सर कि अरे दूध नहीं पिला पा रहे तुम अच्छे से, उनको दूध नहीं आ रहा है. So that also increases the stress level for the female, and they just feel that they are insufficient for the baby, and stress level increases, and again the female can end up with postpartum depression. So unrealistic expectations are one of the major cause of postpartum depression. Then pregnancy and birth related factors. Like if it is an unwanted pregnancy or unplanned pregnancy and still the female has to deliver the baby, so again it increases the stress because they have to see social factors and other cultural factors and financial issues. So that can also end up with stress and postpartum depression. Then complications during the pregnancy, if it is again difficult labor or there are infections during the pregnancy, so it can increase the stress level, and yes, the female can end up with depression. And multiple birth, एक बच्चे का ही लोगों से संभलता नहीं और वहां अगर 2-3 हो जाए तो अगेन स्ट्रेस लेवल इंक्रीज होगा. देयर विल बी hormonal fluctuations also very frequently, so again it can end up with postpartum depression. And then young mothers, if the mother is very young and she doesn't know how to take care of the baby, again unrealistic expectations from the people may increase her anxiety. So these are the risk factors for postpartum depression. Now coming to the diagnosis for postpartum depression, सबसे बड़ा diagnosis is the clinical interview with the patient and the family members. आधी बातें वही बोल देता है कि हाँ इसको postpartum depression हुआ है. Then other, if we go on the certain scales which we use for diagnosis postpartum depression, so majorly we use in our clinic Edinburgh postnatal depression scale, and it is available in 12 languages, and it's a simple questionnaire with 10 items, easy to administer and easy to score. And the other is PSQE questionnaire, which is also given for the diagnosis of postpartum depression or any type of depression. So if ठीक है, अभी तो ये डिप्रेशन हो गया है, अभी हमें आगे देखना है कि क्या करना है. So in case if postpartum depression is untreated, then what are the risk factors for it? So पहला risk factor is risk to the mother. If it is not treated well, so it can lead to worsening of mental health in the mother, and if it is not treated, it can increase depression, it can increase guilt, and in extreme cases, it can lead to postpartum psychosis, as we have discussed before, disorientation, delusion, hallucination. So it's a medical emergency which needs to be addressed as soon as possible. Then impaired functioning. Since the mother is dealing with depressive symptoms, she is not able to take care of the thing. So obviously functioning will be impaired. And again, that give rise to feeling of guilt that I am not a good mother, I'm not able to take care of my kid, and I'm not able to take care of the household goals. So again, impaired functioning के कारण it can increase the risk, it can increase the symptoms of postpartum depression, and it can impair a lot many things. Then increased risk of self-harm. Once if it is not treated, that increases the feeling of hopelessness, worthlessness, कि I'm not good at anything, so there is nothing to live up to this life. So they can end up with harming themselves. And in extreme cases, sometimes they feel कि I'm a not good mother, I'm not able to take care of my kids. तो इस बच्चे का भी जीकर क्या होगा? So sometimes they have so many means extreme thoughts कि they can harm their kid also, newborn baby also. And sometimes if it ends up with psychosis, so the hallucinations, the hearing voices, the voices which tell them कि your baby is not good, and because of the baby things are not going good in your life, or baby is harmful for the family, so they can harm their kid also. Because I have seen a case where the female killed his newborn baby because her brother died immediately once the baby was born. So someone said कि ये बच्चा राक्षस है और इसको जीने का कोई हक नहीं है. So she killed the baby, and after that she was brought to the hospital. So it can increase if it is not treated. So it can go to the extreme of cases also. Then physical health consequences, like if the female is not able to take care of herself, so it leads to decreased immunity in her, and again that increases the risk of other health issues, like there is poor nutrition, there is frequent infection, so that can increase the risk of infection in the female. Then strained relationship, because postpartum depression is very less talked about, so people don't understand about it, what it is. So फैमिली मेंबर्स को यही लगता है कि कुछ नहीं है, नाटक कर रही है. So that can lead to strained relationship in the family also, strained relationship with the partner also. So now coming to the what are the risks for untreated postpartum depression for the baby. So first is delayed emotional and social development in the baby, because infants of mother with PPD have difficulty in forming secure emotional bonds, and this affects their emotional regulation and social skills later in life. So these infants are may show signs of withdrawal later in their life, of fussiness when they are distressed actually. Then there is cognitive and developmental delays in the baby also, since the mother is not able to form secure bond with the baby, so they are not able to develop that emotional or cognitive bonding with others. And since the mother is not interactive with the baby, so there is a delay in speech development also of the infants who are born to mothers who have suffered postpartum depression. Then there are behavioral problems also in the baby, like as the child grows old, they may exhibit behavioral issues like aggression, hyperactivity, or difficulty with emotional self-regulation. They don't know how to regulate their emotion in stressful conditions. So these problems arise from early exposure to an inconsistent caregiving and lack of emotional support from the mother. Then physical health risks, like poor maternal care can result in inadequate feeding, leading to growth and nutritional deficiency in the baby also. Now coming for the risk for untreated PPD in families, so parental relationship stress, that because the people are not able to understand the symptoms, so they just feel there is something wrong, and this can lead to strained relationship between family members. And if there are other children in the family, so the female is not able to take care of those children also. So again, that can lead to neglect or behavioral problems in other kids also of the female. So how we can manage postpartum depression? So first of all, hormonal therapies we can use for the management of postpartum depression, though it is not a first line treatment. Like many doctors recommend estrogen therapy for treatment of postpartum depression if there is lot of hormonal imbalance, but it is not the first line of treatment. Other is since, as I have told already, ki there are some females have thyroid dysfunction during their pregnancy. So if early screening can help us to treat those thyroid dysfunction, which can help to overcome the mood swings. Then other management things include medication which target neurotransmitters. So in this category, we usually use antidepressant and anxiolytics. So antidepressant, usually SSRI, selective serotonin reuptake inhibitors, are the safest to use in pregnancy. They increase your serotonin level, and serotonin is a neurochemical which regulates our mood, which makes us feel happy, focused, motivated. So SSRI improve these levels, which can help improve the depressive symptoms in the female. And in the most safest is which I use in my practice is sertraline SSRI, which is not expressed in breast milk, and it is very safe to give to a female, breastfeeding female. Then we can also use anxiolytic, but not very much recommended because they cause drowsiness in the baby because they are expressed in breast milk. So not very much recommended. But in case of extreme anxiety, we can use those medicines also, but short-acting anxiolytics. Then anti-inflammatory medicines also we can use, like omega-3 fatty acids, since postpartum depression is associated with inflammatory changes in our body. So omega-3 fatty acids are the safest one which we can use to decrease the inflammation and to relieve the symptoms of postpartum depression during initial phases of the symptom. Then diet and lifestyle changes can help to overcome the inflammation and reduce the stress hormone level, which can also help to overcome the symptoms of PPD. And then psychotherapy in combination with medical therapy. If the depressive symptoms are not very much, so we can use cognitive behavior therapy. Cognitive behavior therapy actually it identifies the negative thought, because once the negative thought comes, like I'm not a good mother, that gives rise to the symptoms like anxiety or low mood. So if we address those negative symptoms, and if we are able to replace those negative thoughts with some positive thoughts, so these symptoms won't arise. So cognitive behavior therapy focuses on the negative thoughts and just help the female to develop some coping mechanisms to overcome the negative thoughts. Then mind-body intervention, techniques such as mindfulness or yoga, which help balance your stress hormones, can help you to reduce anxiety and depression in PPD cases. And last but not the least is screening for high risk groups. So if routine screening for PPD based on hormonal and biological predisposition, healthcare providers can screen women who are at high risk for developing PPD. So initial intervention, initial identification and intervention can help us to stop or to manage the PPD at an early stage. Then personalized medications like understanding the genetic and hormonal predisposition to PPD can help tailor treatment to individual patient. For example, a woman with a strong genetic predisposition or significant hormonal imbalance may benefit from close monitoring and early therapeutic intervention. So she cannot end up with severe depression episodes. So these are the management techniques for in case if you come across cases with postpartum depression. Now, management से पहले prevention बोलते हैं. So in case if we start with the preventive measures first, तो शायद नौबत वहां तक नहीं आएगी कि जहां पर हमें manage करना पड़ जाए. So coming to the preventive measures, so first is mental health screening during pregnancy. Early identification of risk factors. Regular mental health screening during prenatal visits can help identify women at high risk for PPD, such as those with history of depression and anxiety or other mood disorder. Then assessment of social support. Evaluating the woman's support system can help identify those at risk of isolation or lacking help, both of which are significant contributor to PPD. So if we identify कि हाँ इस female का support system इतना strong नहीं है, partner इतना strong नहीं है, so if I identify those women, so we can train them how to manage their things post delivery. So they should not have overwhelming feelings कि अब कैसे होगा. So early intervention can help in these females. Then history of trauma and abuse. Women with past experience of trauma or abuse may need extra psychological support during pregnancy and postpartum period. So again, identifying these women and managing them since before the delivery can help in reducing the risk for postpartum depression. Then education and awareness. वैसे भी बोलते हैं education से बढ़कर कुछ भी नहीं होता है, तो यहाँ पे भी education ही काम आती है. So education about PPD. So providing expectant mothers with information about the signs and symptoms of PPD helps in early recognition and intervention. Then setting realistic expectations, जो कि बहुत जरूरी है. Educating mothers on challenges of parenthood. माँ बाप बनना सबको पसंद होता है, लेकिन it comes with some challenges also, जो कि माँ बाप को पता होना चाहिए कि post delivery ये challenges आ सकते हैं. So initially, if we start training them about those challenges, so after delivery, it won't be a overwhelming feeling for them. So educating mothers on the challenges and encouraging realistic expectations about birth, breastfeeding and infant care. कि आराम से आप कर सकते हो, इतना हाई तौबा मचाने की जरूरत नहीं है इन सब चीजों में. Then partner and family involvement, including partners and family members in discussion about PV. Education is not only important to the female but also to the family members की post delivery what changes can happen in a female, what changes female goes through. So if we educate the family and the partner also about it, so they will be aware ki how they have to behave or how they have to take care of their female. So again, family education is very important. Then therapy and counseling. In case if a female is more prone to develop PPD, so perinatal CBT will definitely help her out to overcome challenges post delivery, because in CBT we just teach them the coping skill, how to identify the negative thoughts, how to replace them with positive thoughts. So that can definitely help out a female. Then interpersonal therapy, like which focuses on improving interpersonal relationships, क्योंकि mostly बिगड़ जाते हैं post delivery, as I have discussed before. So initially, if we train them how to carry those interpersonal relationships properly from the initial point, so that will definitely help us. Then support groups, engaging in prenatal support groups, either in person or online, can help women build connections with others and with others who are facing with the same problems, so they can cope up. They can teach them how to cope up in the future post delivery. Then physical and hormonal health, like exercise, which is very important, because moderate regular physical exercise releases good hormones in our body like endorphins. Again, they reduce our stress level, and that can help us to cope up with the anxiety and depression which is associated with PPD. Then balanced diet, including vitamins and minerals, again, which is very helpful to get that energy back. And sleep hygiene means encouraging good sleep practices helps manage stress and reduce fatigue in postpartum period. And then again, which comes under preventive measure is social and emotional support, like building a support network, partner involvement, and midwife support in some places also very helpful. Then stress reduction through mindfulness, meditation will definitely reduce the stress hormone level, which can help to reduce the symptoms of depression. Then addressing pregnancy and birth-related anxiety, which involves attending prenatal classes, can help reduce fear, anxiety, which around the labor, about the labor and delivery by providing knowledge and coping strategies. And planning for postpartum care also means creating a postpartum plan that includes help with infant care, household chores, and self-care can reduce the likelihood of overwhelming and exhaustion, which can trigger PPD. So obviously this will also help. And last but not the least, if the medical management is required for high-risk women, so we can start medications since the beginning, which are very safe, and so that the woman cannot end up with severe type of depression. Then coming to self-care practices, what a female can do to avoid postpartum depression if she is susceptible to it or if she is not susceptible to it. But I think every woman who goes through the pregnancy and who goes through labor or who goes through postpartum period should have certain self-care practices incorporated in her lifestyle, which include mindful breathing, mindfulness meditation, mindful feeding, and mindful walking, and sometimes journaling and gratitude. They should be thankful for whatever they have in their life. Then prioritizing adequate sleep, like sleep when the baby sleeps, and share responsibility with the family members. Create a restful sleep environment, which is called sleep hygiene. Set boundaries for the visitors, because बच्चा होता है तो रिश्तेदार पहले आ जाते हैं, तो बच्चे के साथ साथ सोना वोना होता नहीं है. So make sure कि she should set boundaries for the visitor. See, this time is allowed for the visitor. Apart from this, no one is allowed. Then coping with nighttime wakefulness, like if the baby is wakeful in the night, so the female can give responsibility to the partner ki when the baby is wakeful, you take care. During feeding, I will be available. So that also helps the female to uh, sleep properly. Then self-care strategies, which includes definitely for all balanced diet, take out time for yourself, spend time with you, me time जिसको हम बोलते हैं. Then setting realistic expectations कि ठीक है, I am a parent but I have to set some realistic expectations for myself and for my family members also. Then professional help is required, should be given. So last but not the least, reducing stigma and promoting awareness. Openly discussing about postpartum depression can help normalize the experience and encourage seeking help. Advocating for improved healthcare policies, resources, better support for new mothers. So my conclusion is PPD is common but often under-recognized mental health challenge that can have profound effects on both mother and their families. It is crucial to understand that PPD is not a sign of weakness. जैसे काफी बार माओ को लगता है कि शायद मैं अच्छी माँ नहीं हूँ इसलिए मुझे ऐसा हुआ है. तो ऐसा नहीं है. It is not a sign of weakness. It is a mental condition which should be addressed properly. Though early identification, supportive intervention, and comprehensive care, mothers can find relief and recovery. So again, encouraging open dialogue, reducing stigma, and fostering strong support network are essential steps in promoting maternal health and ensuring that no mother faces PPD alone. Thank you. Thank you so much.
Thank you, dear Roshita. A very nice presentation. May I request for Saiti to please show the certificate of appreciation?
Yes, ma'am.
Yeah. We have received some questions. Yeah.
Yes.
Will you please stop sharing? Yeah.
Yes.
Yeah. Yeah. Saiti, this is a small token of appreciation from our side for contributing as a distinguished speaker for today's session. Thank you so much for enlightening all of us.
Yes.
So as my program timing is only half an hour, it's exceeding more than 1 hour. So both the talks are very interactive and very interesting. So Dr. Malde, I've received some questions. So without wasting time, I'm taking the question. This
Sure,
is on
ma'am.
the YouTube I have received. See a very nice comment. This is by Dr. Mujibbar Sheikh. He is writing a very nice presentation, Dr. Malde, and congratulations to Ritu Madam also for inviting such good speakers. Doctor, I am from Pakistan. Now I am at Mongolia, practicing here. Mongolia in China, he's practicing. Here we are getting lot of here we are getting lot of sex toys. As Madam has also mentioned, we are also seeing lot of patients with the infections who are using the sex toys. So please suggest some points regarding the cleanliness and how to maintain the hygiene while using the sex toys.
Yes.
The doctor is joined from Mongolia, all the way from Mongolia, China.
Yeah. That speaks a lot about the success of your initiative.
Thank you so much.
Well, the availability is not a problem here in India as well. Lots of online platforms are there which do supply these sex toys, which are otherwise in a gray zone according to the Indian law. But yes, the any illegal item is easily available in any country, maybe at a little premium rate, but it is easily available. Now, as far as the infection caused by the use of such sex toys, it requires just minimum hygiene practices, like wiping them with a disinfectant, like even a sanitizer will do a lot work. Now, many dildos or artificial penis or artificial vagina are there which are battery operated, so their motor part should never be immersed in water, or they should not be washed with water. They should be cleaned thoroughly with the help of cotton or tissues and disinfectant. The simple sanitizer is sufficient enough. And for those who are little more conscious about it, they can use a little more stronger disinfectant like Sidex or similar products can be used to clean it. And as far as the artificial vaginas and dolls are concerned, if a man has ejaculated inside it, then cleaning it should be, very meticulous, because this fluid tends to remain inside if not cleaned thoroughly, or if it is cleaned only superficially. So in deep crevices, sometimes the seminal fluid remains for few days, and that can lead to very bad infections. So just like
Yeah.
any other devices that you use after care, after use, the care is important, and they should be cleaned thoroughly.
Yeah, thank you. Thank you so much. Yes, very perfectly you have covered all the points. Yes, well, these days I am practicing in Koreba Park, Pune. We are getting lot of youngsters who are coming. Yes, they are giving the history. Once we are seeing the lot of vaginal infection. Once I
Right.
ask them that are you using for the sex toys, then of course we have to explain them properly. As Dr. Malde sir has clearly explained, we have to explain them properly how to maintain the hygiene if they are using the sex toys also. Sex is not a crime. These days means a lot of youngsters are coming. Yes, there, madam, with whom we can discuss all this. So what the half knowledge they are getting from the net, they are seeing
Right.
only that. And with that, there is
Yeah.
lot of problems also.
Yeah.
Lot of problems are coming.
Yeah.
Yeah.
One
Please.
common practice can solve lot of issues is that
Rekha ji.
while using artificial penises or dildos, they should be used with condom. So condom automatically becomes a barrier contraception, which is a popular barrier contraception, can become a good barrier to prevent infection as well. So after every use, they can discard the condom easily.
Very true. Very true. Yeah. Thank you. Thank you so much. We have received here one comment from Dr. Raj Ratan Gupta. Wonderful presentation by both the speakers. Yeah. So there is one question, one more question. That is actually doctor ने अपना नाम नहीं लिखा है. There is anonymous. It's coming. This is for Dr. Malde only. Actually, I'm not getting the question. Wait. Just a second. Meanwhile, Dr. Roshita, other question is for you. So, what do you think about the use of the sertraline? A lot of patients are coming these days. They are reading in the Google or in some platforms. They are reading for the postpartum depression. You know, these days all the patients are coming to us post Googling. They search that this drug is for this drug is for that. Usually the patient comes and tell, we have taken this, we have taken this. Today only I can give you the example. I have seen one patient of UTI. I told her, you are having along with that lot of vaginal infection. Since how long? Ma'am, I have taken 2 tablets of Norflox, 2 tablets of Augmentin, and 1 tablet of Cefuroxime. So still it is not going. That's why I came to you. So now after taking, they Google everything and they take all the tablets one. And now they are approaching to us. तो अगर हम यूरिन एनालिसिस भी कराएंगे तो क्या रिपोर्ट आएगी? मतलब ऑफ कोर्स कल्चर भी कराएंगे तो क्या रिपोर्ट आएगी? So just giving examples. So please suggest us the name of the 2-3 drugs. You can tell us the content. No need for taking the brand name. So which are the safe for the postpartum depression?
So for the postpartum depression, SSRIs are the safest one, ma'am, and in that sertraline is the safest one because it is not expressed in breast milk. So it is safe for the child also. So sertraline, usually I recommend sertraline, but yes, in case if it is severe depression and it's not going with sertraline also, then we can try other medications also like paroxetine or SNRIs also. But at that time, then we have to instruct the female not to breastfeed the child. But with sertraline, she can breastfeed the child any time of the day. It's not a problem. And regarding the anxiolytic also, if the anxiety is very severe, then usually we give short-acting anxiolytics like lorazepam because it goes off the body very easily. But usually not recommended. But in high risk only we recommend it because if it is expressed in breast milk, the child will also feel drowsy and then fussiness develop in the child also. So sertraline SSRI is the safest one in breastfeeding. And then yes, we have to weigh the risk also. If the symptoms are very severe, then we immediately ask the female to stop breastfeeding, and then we shift to antipsychotics also if delusions and hallucinations are there, and other antidepressants also we give them.
Thank you. Thank you.
Yeah.
Thank you so much. I'm taking this one last question for Dr. Malde, sir. Sir, this is from Dr. Ajibur Sheikh. He is joined from Faizabad, UP. He is writing, sir, you have shown lot of sex toys and devices in your presentation. You have covered all the things. Is it any devices coming for the premature ejaculation? So please enlighten us about that also.
Well, there are no specific device for premature ejaculation, but the penis sleeve or the one which we have seen, the strap, the penis with the strap, the penis is hollow. The strap is a hollow, so many people who tend to ejaculate early can put their erect or semi-erect penis inside the hollow toy or hollow artificial penis, and then they can continue their thrusting until their partner reaches orgasm. So such a penis extension or artificial penis with harness or pelvic strap, people are using with something like this. And of course, I mean, many people are using some jellies with anesthesia also. And there are some condoms with anesthesia, extra long condoms also. So even those can also be classified as sex toys, condoms to facilitate delay ejaculation.
Thank you so much.
Yes.
Besides that, I'm getting all this appreciations for the wonderful webinar. So thank you to my both of speakers. And yes, Acha, thank you,
Thank you
Dr.
so much,
Tushar,
ma'am.
for joining also and for such a nice comment. Congratulations, is writing, and for both the speakers and the host. So friends, rest questions we can take tomorrow. It's already 10:30. All of us came directly from the OPD and sitting in the front of the laptop. So tomorrow I am also having one great speaker, one of my great friend, Dr. Gajanan Bhattis will be there tomorrow. Tomorrow we are having again a very interesting topic of the sexology only. Sex has no expiry date. I am receiving so many comments. Ma'am, आपने गायनी के topic लेना बंद कर दिया क्या? So many topics are comments are coming. So I have done yesterday because yesterday I had only taken the talk for the gynae. So that's why I keep in this week the two sexology. Anyhow, thank
Yes.
you to both of you.
Thank you so
Thank
much.
you, Anand sir,
Thank you so
also
much,
for
ma'am.
joining. Yeah,
Thank you. Thank
Thank
you,
you so
everyone.
much, ma'am. Yes.
yeah.
Thank you.
With
It
this,
was very nice presentation from both the
yes.
speakers. Congratulations to both of them. Yeah.
Both have done very nicely, very nicely. So with
Thank
this,
you
we
so
Yeah.
will
much,
wind
sir.
up
Yeah.
for today.
Very
We will
good.
wind up for today, friends. Bye-bye. Good night. Thank you once again to everyone who have joined.
Right.
And thank you to Sahiti and Shield Pharma also for providing the platform from last 5 years, 4 years. We are going to complete in 2024. Only 1 or 2 months has been left. So bye-bye. Good night, everyone.
Good night.
ma'am.
Good night, everyone.
Good night. Good night.
Yeah.